All right, so today we're going to go over the catheterization just for the male one today. When you guys come back, we'll do the male and the female. So make sure you read the technique guides on both of those. Positioning wise, you guys will have ones that have legs that you'll have to position, but you'll want to position your patient's legs first, which normally would be in the frog leg position. So you get the patient's legs positioned. Then you guys are going to grab your kit, and these have to be done under sterile technique. So you're going to open it just like we did the prep, or your gowns or your gloves. So you're just going to open it up, and you're going to keep in mind everything on the inside is considered sterile, so we would need to use the open gloving technique. You'll see a lot of nurses that, again, like I did with the prep, they did it over the patient, and that's totally fine if you want to do that, or off to a separate stand. But again, you can't touch what's inside there until you have your sterile gloves on. This is one of those instances where the patient gets a urinary tract infection. The insurance won't pay. Hospitals have to eat the cost of the procedure. So just some things to keep in mind. Okay, and then just remember how you can pinch, drop that off to the side. You're going to want to come over to your Foley kit. A couple of things in here. There are gloves, just like with the prep. They're very, very small. They're very, very hard to get on, so a lot of people don't use them. And then you're going to have a couple of drapes in here. So you're going to have a bottom sheet, okay, and this is meant to get tucked underneath the patient's bottom side. So like we did with the prep, go ahead and tuck and protect your hands. It's going to slide in just like that. Then you have one that has a little cutout in it. You're going to take that and you're going to drape that over the patient, and this is for male and female. You'll do this type of draping for both patients. And then looking in your prep kit, a couple of things that cath kit, a couple of things that you have. You have the catheter, the urine meter down here. You want to go ahead and get this prepared, because you're only going to have one hand to work with. So some things I would start with is take the wrapper off of the Foley catheter, just discard it off to the side. You've got some fluid to fill up your balloon. You can go ahead and attach that. This has a soft insert. Most of them have a hard little hub there, but you can just go ahead and insert that, and that's one less thing that you're going to have to fiddle with. Okay, you've got betadine. When you guys come back in the mannequins that we use, we won't have you use betadine, and if the patient has an iodine allergy, you can use chlorhexidine. You don't want to use alcohol, especially in this part. But you're going to soak your cotton swabs. Okay, and then you have sterile KY jelly. What you'll see some nurses do is they'll squirt it here into the container, or you'll have some that will take this off and they'll just take it and they'll dip it inside here. One thing about doing that, what you can do is end up clogging the catheter. So it's really going to be preference on what you want to do. If it were up to me, I would just do it onto the side of the canister. Make sure it's lubricated, and then just leave it just like that. Okay, and then what you're going to want to do when you go to insert the Foley catheter, you can only use one hand. So you want to make sure you're using your dominant hand to insert the catheter and do the prep. So my left hand is going to become now contaminated, and when you cath a male patient, you're going to want to hold it just like this, straight up and down, because you have to pass through the prostate. With a male patient, what you're going to do, male and female, you're going to do 3 prep swabs, but you start at the center, swab your way out, and don't put it back in the tray, discard it off to the side. Second swab, center, swab around, and then your third, center, swab around. If this were a female patient, you would start at the top and swab down and repeat that 3 times. Now this is considered contaminated, so set it off to the side, make sure it doesn't go back into your tray. Then you're going to want to pick up the catheter, and you're going to want to watch and make sure that none of it touches any of the non-sterile areas. But you're going to hold it straight up and down. You're going to pass this through. With male patients, what you need to make sure is you're going to be inserting all the way to the hub. I'm actually starting to meet some kind of resistance somewhere. So if you start to meet resistance, it means you're probably passing through the prostate. If you meet resistance, you need to stop. So don't force it in. Any resistance, you stop. Get this out of the road. So again, with male patients, even though if you're getting urine, you go all the way to the hub. And once you're in all the way to the hub, you're going to hold the hub and you're going to inflate your balloon. Okay. Then you're going to take the catheter and you're going to pull it and let it pull it so the balloon is resting in the neck of the bladder down there. You know, it's probably pretty hard for you to see, but you want the balloon resting into the neck of the bladder. So again, I just can't stress enough, when you go to insert this, you insert all the way to the hub on the male patient, because the male urethra is much longer than in a female. So all the way to the hub. When it comes to cathing a female patient, you're going to insert until you start to see urine. When you see urine, you're going to insert another full inch, and then you can inflate your balloon. Sometimes if patients, maybe you're dehydrated, things like that, you may have to use your arm and press on their belly to kind of, or press on their bladder to get some urine to come out. But you really don't want to inflate the balloon, male or female, until you have some urine return. And then to DC a Foley, you're just going to take your syringe. This is something you might do at the end of the case. You take your syringe. Just be mindful of how much you've put in the balloon. So if you put 10 or 8 cc's in, you want to make sure and get that actually back out, or you're going to cause damage pulling the catheter out. So what you're going to want to do when you go to DC these at the end of the case, just be very, very mindful. Don't just pull, because once you pull it out, you're going to have urine kind of going everywhere. So just carefully pull it, okay? And then just control the tip of the catheter. Again, that way you're not splashing urine around, and then you can go ahead and discard it in the trash, okay? And then you would just keep in mind to properly take off your sterile gloves, just like that.